And welcome back. When this show last aired in December, we were just on the precipice of rolling out the much awaited and anticipated vaccine for the coronavirus. But also at that time, the state and county were in the midst of increases in the number of coronavirus infections and hospitalizations, which prompted both the state and the county to reimpose restrictions on restaurants and other places of worship that seemed onerous to many, but seemed necessary to the county. Now, 2 weeks later, the number of coronavirus cases continues to rise, but the rate of hospitalization seems to have stabilized since December 19th and may be falling. Phil, the long-awaited vaccinations and vaccines have been made available, and each state is responsible for handling the distribution process. How has it gone in Maryland? Governor Hogan has been under some criticism, at least up in Baltimore, for the process.
Yeah, I haven't seen anything really negative. The reality is with Maryland, as with all states, there's always going to be a little bit of a, hitches here or there, hiccups, somebody complaining about one thing or another, especially because it's not like Tylenol where you can go out and just get it whenever you want. What I think is more noteworthy is how, going back to something you said in your question, which is how the testing process and some of the other things have been done, how we continue to have no standards on that, which is leading to a lot of false positives and ultimately a lot of the problematic restrictions that are unnecessary that have been imposed in advance of the vaccine.
Thank you, Phil. Mike, what's your view on how the vaccination process has gone so far, and also the response that the county has made to the coronavirus cases?
Well, I think it's been interesting because I listened to General Perna, who's responsible at the federal level, back in early October, and candidly, to listen to him talk about how we're going to massively address this and the efforts that were underway, kind of made it sound like we're in good shape. And then I was seeing how the rollouts actually occurred, and clearly there's a number of disconnects between the federal, the state, and the local jurisdictions, which again, to Phil's point, I don't think is a huge shock that you're going to have some of those glitches, but given what I heard versus what we've seen, I think is a challenge. I think one of the things that I've seen I'm a little frustrated with at the local level is we've got kind of the categories of people who are supposed to get vaccinated in what order, but what I've not heard is then to what end? What's our plan as we do that? Why are we picking these populations? Obviously we want to get teachers vaccinated because ostensibly we want to get people back in school, but what's the plan for doing that? What's our plan for getting all those teachers vaccinated and talking about that, and then really having something that we're shooting toward? What's our North Star, and what are we trying to get to? And I've not heard that. These are all kind of discrete activities. We want people to get vaccines. Then to do what? And I don't think there's that big picture that I just haven't heard anybody talk about yet, because ultimately soon we want to get back to being operational. Well, what are the steps we need to take to get there, and how do the vaccines play a role in that?
Well,
besides just in a macro sense.
I think that's been a criticism of the county since the beginning, is their transparency and their communication with the public. They seem to be top-down management oriented. Mark, what's your view on all of this?
I was going to pick up on that, an observation looking at other states that have run into particular problems with vaccine distribution. There seems to be a common thread to them of being overly prescriptive as to who and how the vaccines will be distributed. And then when enough people who qualify under that distribution plan don't come forward, the vaccines don't get used. And so a certain amount of flexibility is really necessary with the distribution in order to get things out, so things get done in a rapid way, and we get through this as quickly as possible.
Well, I want to leave with the segment with some anecdotal but positive stories, and two of the best that I've heard is one fellow, and I believe it was in Virginia, but it could have been in DC. He signed up for a wait list for the vaccination, because once these things are thought out, they have to be used. And he was able to get vaccinated within 1 day because someone didn't show up to get their vaccination. They have 30 minutes or so to get there. And so he got vaccinated. So if your hospital has a waiting list and you want the vaccine, you may want to do it. And the other story was a couple, I thought it was in Bethesda Beach, walked into a Safeway store and were told that they could get the vaccine right then and there. So I think if you want to get the vaccine, you need to explore a little bit, not just the government websites, but some other resources as well. And Carolyn is giving me the shut up sign. So when we come back, stay tuned for parting shots.